Every time I'm asked to speak about the starting of Hospice Africa Uganda, I'm humbled by Professor Dr. Anne Merriman. She is the one that started Hospice Africa Uganda, along with some friends of hers. And when she came to Uganda at that time, in 1993, Uganda was grappling with HIV/AIDS and its effects. That was the time before we got antiretrovirals. So we had the typical slim, and at that time it was so painful. We had cancers like Kaposi sarcoma, we had cancer cervix, we had all sorts of cancers at the time, mainly because of the depressed immunity, but also I think the disease itself was also causing other conditions like herpes zoster, which was very painful. So when Dr. Anne came and started this program, she went straight to Ministry of Health. And she always tells of the support she got from the Ministry of Health. We've seen a lot of giving from the Ugandans in terms of staff. Many have come to volunteer when they hear about the kind of patients that we look after. They volunteer time, they volunteer technical knowledge, expertise, materials. We've received adult diapers, we've received wheelchairs, we've received crutches, we've received so many things. Others have said, let me take this patient to my home and look after them. It's true that a very big bit of our budget came from outside Uganda. A lot of donations from outside Uganda. Up to about 2015, when one of our biggest grants ended. But from 2015 up to now, we've seen more and more and more of Ugandans raise funds for hospice. I came to be ED at Hospice in July 2019. And while I'm still studying the organization and having all these nice ideas, there's a lockdown in March 2020. It was hard. We are a team of about 74 in total, and we didn't take home salary the last 2 months of that financial year. We told our board members, we don't know what to do. And the patients kept calling. That lockdown was the hardest. This lockdown, I think we were prepared in a way because we had seen the previous one. Within this lockdown, our biggest challenge, of course, the whole COVID environment has made fundraising hard, very hard. So we've had to reach out to people and say, please, we have a very big budget. It's not working out. Give us something. And in addition to the Hospice Africa family and all other international donors, we want to really recognize the Ugandan community. We run a social media campaign. You may have heard about it. And we're asking for what? Is it 100,000 every month or 3 months? Some were asking for 50,000 Uganda shilling, and we have people that have come out to give. We have over about 60 people that have come out to be part of this, and they're giving every month. It's been encouraging. We have some Ugandans in the diaspora. They are giving every month, faithfully. So we've seen a lot of giving from different parts of this country. I remember sending a list to the COVID-19 task force of patients and their locations. And I was very happy to see that those locations actually got food delivered in those places. And I'm hoping and praying that our patients got something. I am aware that not everyone, can give to hospice. But I also know that, we have a very big need at hospice. So I call on everyone that feels that they can do something to support our patients. It's not just their medical needs, if I can put it that way. Some of our patients need a home. There is a gentleman from Germany who has intrigued me so much. Like every time I think about him, I ask myself, what is going on in this man's mind? So this man gave us money to move a certain patient from where she was staying in Buya to a house somewhere in Namungona. This lady was staying in something that's the size of a big box. I think a box that can fit a fridge is where she was staying. And it was so small, she was living in that tiny little thing with her daughter. And every morning they would take out a basin of, excreta. Yeah. So we found this lady, she was in so much pain from HIV, and we gave her painkillers, but we felt that we had not done enough with just our painkillers. This lady needed to move to a better environment with her daughter and pick up. She was literally lifted out of that house into the car and lifted from the car into the new settlement. And this gentleman pledged to pay for her rent for a year, and during that time the daughter was tasked to find gainful employment. So within 2 weeks this lady was standing and walking. We didn't know that what God had in store for us was somebody who could walk, somebody who could be pain free, and also start to get her own gainful employment. So that is what giving can do. This is someone given new hope. The death sentence is literally gone, and she's starting off on a new slate. So I urge people, look into your community and see what you can do. If you're unhappy with what your money is going to be used for, you have every right to investigate all these organizations that are benefiting from your giving and see, do they do the right thing? And if they do, then you can give to them.